Sudden chest pain triggers panic. We hear heart blockage and assume the worst. But addressing that fear requires looking directly at the underlying biology. The heart is a muscle with a singular, non-negotiable requirement: a continuous supply of oxygen-rich blood. This fuel is delivered through a specific network of vessels called the coronary arteries. When these arteries are compromised, the body signals distress through a recognizable pattern. You might feel heavy pressure or a tight squeezing sensation in the center of the chest. This pain often radiates outward, traveling to the left shoulder, the arms, or up into the neck and jaw. The timing of this pain reveals its severity. If the pressure builds during a walk or while climbing stairs, and then fades with rest, it is classified as stable angina. However, if that same squeezing occurs while you are sitting still or sleeping, it is unstable angina, a medical emergency. This discomfort is a localized signal that the heart's essential oxygen supply lines are being choked. Atherosclerosis drives this process, the progressive buildup of fat and cholesterol on the inner walls of the coronary arteries. During physical activity, oxygen demand spikes. As blood flow attempts to increase, cells begin bottlenecking at the restricted zone, unable to deliver the required volume. Several factors accelerate this plaque formation. High-fat diets, smoking, and uncontrolled diabetes create the ideal conditions for arterial damage, while family history and age provide the biological baseline. The crushing sensation of angina is the physical feeling of the heart muscle suffocating from the inside out as these pipes fail. When symptoms become persistent or a treadmill test shows abnormalities, doctors use an angiography. This is a diagnostic map, not a treatment in itself. By injecting a special dye into the bloodstream, X-ray images can pinpoint the exact location of a blockage. This visualization highlights the obstruction, often revealing where an artery has narrowed by 70% or more. If the blockage is severe enough to risk a heart attack, or if medication can no longer manage the symptoms, the medical team moves to a mechanical intervention called an angioplasty. A deflated balloon is threaded into the restricted area. Once inflated, it compresses the plaque outward against the artery walls, widening the path. To keep the artery open, a wire mesh stent is deployed. It remains as a permanent scaffold, preventing the walls from collapsing. Reopening the vessel restores blood flow and saves dying heart muscle. But this engineering only addresses the crisis at a single point in the network. It is a common misconception that an angioplasty cures heart disease. In reality, the procedure only manages the symptom of one specific blockage. Because atherosclerosis is a systemic condition, new blockages can form in a different arterial branch, or the stent itself can become obstructed if the underlying disease continues to progress. Following the procedure, medical mandates are non-negotiable. Patients must maintain a strict regimen of blood thinners and cholesterol medications, as stopping these drugs without a doctor's guidance significantly increases the risk of a secondary event. Halting the disease requires shifting to a low-oil, high-fiber diet and committing to 30 minutes of daily walking to strengthen the cardiovascular system. Consistent monitoring is also required to keep metabolic factors like blood sugar and blood pressure within a strict, healthy range. The heart is a resilient organ, but its recovery depends on these systemic lifestyle shifts being established long before an emergency room visit becomes necessary.